our next group of panelists who are specifically going to speak to advocacy, policy, and collective action. So hopefully you're hearing threads of cross-sector collaboration, as well as now you'll hear more particularly to movement building and coalescing a number of different interests and voices in these cross-sector collaborations. So I'll welcome our folks up now to speak to collective action in this policy and advocacy space. We have Dr. Joseph Chiarella, Chief Medical Officer, UnitedHealthcare Community Health Plan of New York. David Hansell, Commissioner, New York City Administration for Children's Services. And Michael Sheldrick, Vice President, Global Policy and Government Affairs, Global Citizen. Thank you three so much for being here with us this afternoon and for being a part of this really important portion of the conversation that we're more broadly really focused on how can we mobilize collective action? How can we make these 2 days of learning not just a sit and get and go, where hearts and minds and individual offices are more information rich, but that we're actually taking that information and applying it to how we can collectively end violence and exploitation of children. So I'll ask you first just a little bit about how you and your organization is involved in ending violence against children and your role in the effort.
Starting with me?
Sure, certainly, Doctor, go ahead.
Thank you, everybody, for sticking to the end. Sometimes the best stuff comes at the end, so I appreciate it. You know, it's interesting, and I'm glad that Mount Sinai took a health insurance plan as part of the program today, because one of the things that an insurance plan has is, first of all, a lot of data. And we also have a REACH, UnitedHealthcare Community Plan, serves some of the most disadvantaged and complicated patients throughout the state. So we are in sometimes a unique position to see what's going on and to collaborate with all of my colleagues and all the speakers that we've been here before. An insurance plan is in the criminal justice system, is in the school system, is in every homeless shelter in the state of New York. So we do have a unique perspective and opportunity where we can interact. Now, violence doesn't always come and knock on your door and say, this is it. You have to use tools, you have to use data, you have to use algorithms, predictions, something called emerging risk, which are computer programs, and sometimes it's just the instincts of the staff that we have to figure these things out. And so one of the things an insurance plan can do is assemble the data, work with all the partners. Every doctor knows who UnitedHealthcare is, every hospital, every agency. So we do have an opportunity to sort of look into the crystal ball a little bit and provide some insight.
Great, thank you.
Good afternoon, everyone. I'm delighted to be here, especially following on the heels of my wonderful predecessor, Commissioner Gladys Carrion, and my wonderful colleague, Sue Morley. And so ACS is really all about preventing violence against children. We would not exist if it weren't for that mission. And yet we can't do it alone. And I actually was sitting through the last panel thinking that it was the best illustration, probably better than I can do, of the importance of collaboration, because we just heard from the Department of Education and Probation about the ways in which all of us across the city work together to make sure that we are providing the best opportunities for young people to be successful, to avoid violence in their own lives, to get the kind of education they need so that they will become healthy, successful adults. So there's no way that we can do that alone. And we do that across our child welfare programs as well as our juvenile justice programs. But one of the core ways that we do it within child welfare is through what we call preventive services. That is, we believe that the first and foremost what we want to do is not respond to violence in the form of child abuse or neglect after it occurs, but to try to keep it from occurring. And the best way to do that is to work with families, to work with parents, to work with caretakers, to help them strengthen their own protective factors so that they can take care of their kids, keep their kids healthy, keep their kids out of violent situations. And so we do that through services that we provide to families, what we call preventive services, which again, we don't do alone. We do it in partnership with 50-some nonprofit provider organizations across the city. But even there, we have more recently taken that a next step and looked at how we can and must use data to make sure that, and this also goes back to the last conversation about resources and how do you demonstrate that you're using resources to support collaboration in the most effective ways. We're trying to increase our sophistication and our ability to use the data that we have about what makes families successful to match the services that we have available with the needs that those families have. And we think that we're increasing our ability to do that, but again, by working in partnership, in this case, with both academic institutions that have the sophistication to know how to analyze data and assist us in doing that, and also to work with ethicists and providers and others who want to make sure, very appropriately, that we're using data in ways that will benefit families and not harm families, that will lead toward increased equity and not toward increased inequity. So there are lots of ways in which we partner really across the board in support of our core mission, which is keeping children safe, and particularly safe from abuse and neglect.
Fantastic, thank you.
Cool. Well, for those that aren't aware, Global Citizen, we're a movement of young people around the world. Currently, we have something in the region of around 24 million people engaged each month taking action. And by taking action, I mean concrete actions, whether it's tweeting world leaders, petitioning local elected officials, or ringing your local member of Congress. And really, this movement comes together around the UN Sustainable Development Goals. And for us, when we look at the goals, the UN, Amina Mohammed, the Deputy Secretary General of the UN, really says that, at their core, they're about leaving no one behind or ensuring no one is left behind. And when you look at the most vulnerable, often it is children, children that are abused, children who find themselves in some of the most remote, vulnerable communities. And so for us, it's about giving those young people a voice. And, I guess our currency is action. Money is important, but at the end of the day, accountability is crucial to delivery. And we believe that, today with smartphones in the age of social media, it's a powerful tool to hold leaders, policymakers accountable to that. And that's our modus operandi. And I guess, whilst we don't have any specific campaigns that focus specifically on the issue of violence against children, you can really see it throughout all of our campaigns. One of the campaigns we've launched in collaboration with the UN, our Level the Law campaign, focuses on discriminatory laws and barriers. And just one of those focuses is around addressing legal loopholes. In many countries around the world, there are loopholes that exist in legislation that allow, children under the age of 18 to still get married. In fact, something like each year, 12 million girls are married before the age of 18. And so for us, it's supporting activists in those communities. It's giving them a voice. It's providing a network which they can tap into of solidarity, of people standing with them to close those legal loopholes. Another one, and I think, when we think about eliminating violence, the idea of, well, what's an issue that cuts across, we really think girls' education is. The research and all the stats show that when girls receive education, they're more likely to stay in school when that's supported. They're more likely to earn independent income. They're more likely when they become women to have greater independence and decision-making power in the household. They're more likely to be able to protect their own children in turn. And so for us, when I look at the opportunity for collaboration, I really think it's girls' education. Now, at the moment, the world is rallying behind this. 2 months ago, we led a campaign. We had the likes of Rihanna bringing her celebrity power, and it culminated in a conference in Senegal. And, we were hoping for $3.1 billion. We didn't get there. Governments came together and they pledged $2.3 billion. And that was great. It was a good effort. I think at the last such conference 3 years ago, it was $1.5 billion. but it was mostly government financing, right? And there's a real lack when it comes to girls' education. You know, we see cross-sectoral collaboration on issues such as health. You know, we see foundations, we see celebrity advocates, we see philanthropists. We're not seeing that on girls' education. You know, who is the Bill Gates when it comes to girls' education and the most vulnerable? Because like it or not, you know, some of the most vulnerable, you can look at the demographic, it is adolescent girls. Who's giving them the voice? So when I look at the opportunity for a sector to come together, it really is that issue, and it's something that we've been trying to work on and mobilize our community around.
Great, fantastic. And I think that leads right into my next discussion and next question. I live in Jacksonville, Florida, which is only a little more than 100 miles from Parkland. And from the tragedy that happened there, we have seen an incredible surgence of youth voice and of student leadership. And so thinking about the power of youth voice and policy change through watching the students of Stoneman Douglas High School students who have come together and now expecting, you know, maybe 500,000 people in Washington tomorrow. What is the importance of leadership and of catalytic leadership in building a movement? And what do you recommend as a basis for developing that roadmap? And I'll sort of add into this question, a couple of you mentioned accountability. And who's accountable to leading or to that leadership as we think about this movement building. And Michael, I think from your last comments, you're probably best poised to kick us off here.
Yeah, I mean, I think it's incredible what's occurring on this issue. I mean, as you can tell by my accent, I'm not native to New York City, but in my own country, in Australia, just over 15 years ago, unfortunately, it took a huge tragedy to bring people together around addressing the issue of gun violence. And so when I look at something like tomorrow, I really hope that what we're seeing is a catalyst that people are latching on into, and it will result in policy change. And so for me, I'm always interested, well, how can you ensure that these moments become a movement eventually in time, and how can you harness that? Because unfortunately, you look back over the last 5-6 years, there's been many, you know, around potential issues. There's been many, if you like, flurry of activity over a month-long cycle or 6-month-long cycle, but then what is sustained after that? You know, I'm not sure how many people in the audience might remember the Kony 2012 campaign, which occurred in 2012. It was around Joseph Kony. It was around the issue of child soldiers. And, you know, it was amazing because in this 24-hour period, you had this, you know, awakening of interest. You had this sea of global social media. It really catapulted this issue to the forefront of many people's minds around the world in a way that hadn't really been discussed before. But then quite quickly, the discussion said, well, what next? Where does this go? And so for us, when we're at Global Citizen and we're looking at campaigns where we apply our scarce resources, because, you know, it's funny, I'm an advocate, but these days, through LinkedIn, Facebook, I'm almost lobbied myself. You know, I'm an activist that gets lobbied too almost every day with people saying, can you take on this issue? Can you champion this issue? And really for us, it's about, well, okay, what's the clear roadmap to change here? You know, and we sit down and we say, like, what is the clear, concrete ask, and what is the pathway to delivering that? Is it a law that needs to be changed? Is it more funding? You know, what is it? And then secondly, who has the power to do that? And it doesn't just have to be a politician. It could be who are the people around that politician, who's their sphere of influence, but map that out and then build what I like to call an echo chamber around that to make sure that it's effective. Because otherwise, I worry that you could end up with this whole momentum, this sea of change, but then unless you harness that, it runs the risk of falling flat. And I think, you know, some of the encouraging things you just talk about, you know, the march tomorrow, you know, I think it's fantastic, the idea on certain we're seeing in the last few weeks, targeting, you know, companies that give, you know, people certain benefits and targeting them. And, you know, in the day of social media, young people have power as consumers, right? So use that consumer power to get companies to, withdraw funding. I mean, that's smart. So where's the next step after that? They're the questions I would be asking.
So, like I'm sure many of us here, I have just been overwhelmed by the way in which young people have seized the agenda since the Parkland shootings. I don't feel like we've seen anything like this in our country in a very long time. And there's not a lot around the gun control issue or federal policy in general that gives us hope, I think, right now, but I think this really does.
Yeah.
And so I felt, as soon as it happened, and as soon as it was clear that young people were going to take the lead, I felt that it was critical for us at ACS as a youth-serving agency to find a way to empower the young people we work with to participate in that. And I'm actually really excited that we've done that. During the walkout on May 14th, young people in our Crossroads Juvenile Center participated. They walked out of school and they walked across their courtyard carrying signs about the need to address gun violence. And tomorrow, I'm going to be marching with a group of young people in our Close to Home program, which you just heard a lot about in our last panel, who will be joining the march here in New York City, again, with their peers to talk about the importance of addressing gun violence. And I can't think of anything more powerful, at least to me as a statement, than a group of young people whose lives themselves have been disrupted by violence, joining a march to talk about how important it is to prevent other young people's lives from being affected by gun violence. So I'm very much looking forward to joining them for that. And I think all of us have an obligation to think about how we can empower young people in our lives to be part of this, what I hope will really be a groundswell that could go from this issue to many other issues. With regard to accountability, I think the most important thing is making sure that in anything we do, anytime we're setting policy, anytime we're developing programs, anytime we're deciding how to allocate resources, that we make sure that the people who are ultimately going to be affected by the decisions that we make are at the table when those decisions are being made. That seems to be the sort of fundamental obligation that we have. And one example of that, which is very much on my mind right now because it's just happened actually this week, is the announcement we made yesterday of a set of recommendations that grew out of a foster care task force that we have been spearheading at ACS over the last year. This is a group that's been meeting for about a year, has developed, and we just announced yesterday a report with a set of recommendations on ways to improve the foster care program in New York City, to make sure that young people who go into foster care are able to leave foster care and move into permanent families as quickly as possible, that they receive the best quality health, mental health, and educational services while they're in foster care, and that we also help make sure that they are put on the road to healthy adulthood and successful adulthood during their foster care experience. And what was critical to that entire process over many, many months and many, many meetings was that we had young people who were or had been in the foster care system involved in all the conversations, and we had parents who had been involved with the foster care system in all those conversations. And it was really their presence that kept us honest, in a sense, in making sure that the recommendations we were developing were actually going to make a difference for the quality of experience and the outcomes that kids in foster care experience. And I think that's the model for what we have to do in all of our decision-making. All of us who have positions in which we exercise some power over resources or policy or programs have to make sure that we're always holding ourselves accountable to the people that are going to be ultimately affected by the decisions that we make.
Great, great. And so, Dr. Chiarella, what about this issue of leadership and accountability?
Well, I think if we come back to the focus of our mission today, ending violence against children, one of the things, and you talk about accountability in the foster care system, is at the end of the day, most of the children should go home and be accountable to their families. And in order to do that in a decent experience, the way most of us expect that it is, you need to have safe housing. You need to have good mental and behavioral health. You need to have programs that help, as the pro lady said, to help parents be parents. Not every parent is the kind of parent we think they are. And so we want to tie all this together to make sure that when our youth speak, that perhaps their mother and their family told them the right things to say, the right things to do. They have an appropriate education. They have support from the healthcare community, from my point of view. So we work closely. Every foster kid is covered in a managed Medicaid program. We work closely with them all day long. Most of them live in a housing that, insurance plans go into and support. Our company has something called whole person care. We're community health workers who come from the community. So if you're Russian, the community health worker is Russian, and so forth. They can go into the house, they can meet the family members, they can see the children, they can go to the community centers, so that at the end of the day, you've tied it all together so that when the students and the young people come out to speak, that they have a decent voice because they've been prepared and taught by us and helped by us so that they can do that. And we are all accountable for that. The money comes from the state, but it comes from the taxpayers. They want us to be accountable for every dime, and we do our best.
Wonderful. And you all have done such tremendous work in building this conversation and in seeking solutions and forging relationships that yield better outcomes for children. How do we collectively build a movement or grow the movement to end violence against children, making it a priority? If you could give us a cheat sheet or a toolkit in a few words for how to do this work, how can we collectively influence our current social norms to be more positive, proactive, and preventative for children? Let's see. David, we'll let you take a crack at it. Yeah.
Well, I think what we've learned in the last few weeks is that the most powerful spokespeople about the impact of violence on children is children. And that's really the message, I think, of what's happened since the Parkland shooting. And so, I think our job collectively is to figure out how do we, in a sense, lead from behind. How do we help children to find their voice, to talk about what they've experienced, to talk about what they're afraid of, to talk about, frankly, to talk about the ways in which we as adults have screwed up the world and have created a situation in which they cannot feel safe. And then, there are things, of course, that we can do to help guide them, to help direct them, to help focus them in ways that will actually make a difference and be productive. But I think, I think the movement is building. And I think what we have to do is find the connections between the structures that already exist, community organizing, partnerships that certainly exist across New York City in many, many sectors, and the sort of emerging voice that young people are finding, and see how we can really synergize those things to the maximum effect.
Great.
Yeah, I think I would echo the comment David made around, I think putting the people who, this actually affects and providing the platform for them to hear their voice. At Global Citizen, many of you might have heard about a small event we do every September on the Great Lawn of Central Park. We have had all the biggest rock stars in the world. We've had everyone from Rihanna to Beyonce, to Coldplay. We've had Pearl Jam. We've had all the biggest names. Last year we had Stevie Wonder, and it's great. It mobilizes 60,000 people. It's broadcast. But, one of the things I'm conscious of is really, this platform, we need to give it to make the young people the rock stars, and they should be. And I think you're right about sometimes people taking a step back. I mean, one of the greatest examples of this in my experience, I mentioned our Level the Law campaign. We were working with a 19-year-old activist in Tanzania, and he was trying to lobby and meet with lawmakers and trying to get a meeting with the president to change one of these laws. And of course, we engaged Forrest Whitaker as an advocate, and he asked Forrest Whitaker if he would come to Tanzania and meet with the president. And of course, I'm sure if Forrest Whitaker had rocked up, he probably would have got a meeting. And I think it was a great testament when he said, here's what I'm going to do. I'm going to write a letter to the president, and I'm going to say you would meet with me, but I don't want to meet with you. I want you to meet with this young guy, Aristaric Joseph, so he can hand you, his petition. And I think for us, that's something that we need to do. we're inviting young people to join our advisory board so that they can make sure they've got their advice. We're inviting them to get up on stage and have that voice heard. But I think the other lesson, when we talk about movements, and it goes back to the comment I made earlier, how do you ensure something is in a moment but becomes a movement? And it's the recognition that it takes hard work. It's hard to engage people. For years we had this idea of using the festival as a platform, and the kind of model behind it is we give away 60,000 tickets, you take action, you earn points, and you can trade in those points on social justice issues to earn a ticket to the concert. And of course, in our first few years, and I'm happy to say this openly, do you think the actions that took place before the festival were sustained the next day after the festival? No, they weren't. It was a drop-off. And it was only through years of trial and error, giving people feedback, telling them how their actions were making a difference, taking the time to engage with them, that actually we've seen this constant, rate of engagement 365 days a year. It's telling people how their actions make a difference so that they don't get disillusioned, so that they don't become apathetic, so they don't think, actually, there is a risk that when you get people rallied up and nothing happens, or you don't feed back to them the difference their actions are making, you can actually make them even more disillusioned. So it's incredibly important. So, I say this because sometimes I have people come to me with great campaigns, and you can have all the free advertising in the world. You can have every single board in Times Square donated with you for a day, but unless you're thinking through how do you channel that, it's going to dissipate. And my last message on that point goes to the funders in the room, and it comes from the previous panel, is it takes a lot of hard work. It takes a lot of time because it's hard work to get people engaged. And then it's even more hard work, changing policy, look at these gun laws. That's a hard slog over many years. It takes time. And we need funders that can back that. We need funders that can see the results, that's willing to go the distance. And the problem is at the moment is many foundations, they love their log frames, and they give us these log frames and they want an immediate cause and effect. And that just makes it hard to do activism. It makes it hard to do advocacy. So we almost need to advocate for advocacy and take those funders on our journey and say, be part of this movement, grow it, and then help us achieve those changes if we're really going to see the changes we want in society.
Well, be advocates for advocacy. I like that. Doctor?
I would say that in terms of a movement, we have so many movements, and I agree with Michael that sometimes a movement, sort of the next day it fizzles out. But from a physician's point of view, the movement sort of begins when the baby's born. It takes 18 years, or these days an adult child can be 26. It takes a long time to raise a child. And we are all responsible for raising that child directly as the father or the mother, or indirectly as the school or the system, life in New York City. So the movement has to have a longer horizon. Okay, it really has to take many, many years. It can't be a fundraising today, an event tomorrow, and forget about it the next day. That's why sometimes we want to make sure that we help families. We help a mother when the baby's born, greet them from the hospital, make sure that their housing is appropriate, they know about nutrition, how to take care of a child, who's living in the house. Come back to the family to make sure that the conditions are okay for a kid to grow up properly, to do well in school. And then when that kid is old enough, their voice is going to be better than someone who didn't get those advantages. So our role as physicians, obviously, every doctor wants what's best for their patient. We do it one at a time. An insurance company, we still try and do it one at a time. The movement really is, how do we raise our children? In this tough society with all these influences, and they have a smartphone computer in their pocket, how do we do that? That's a bigger question. And I think it comes back to the families, the housings, the government has to sort of push this along in some way, as do the insurance companies, the state of New York, and all of us, really, every single person should be part of the movement to make sure that kids grow up properly and they grow up without adverse circumstances like violence in their home.
Thank you, thank you. And I know that myself, just listening as much as participating in the conversation, I'm so encouraged that throughout these three panels, we've heard from the private sector, from the public sector, from the social sector, from folks who represent these different constituencies, a pretty continuous message and a pretty coordinated idea of how we can come together and create some collective action and change. And so as folks are making their way to the microphone, I know we already have one who's ready. I'm just going to ask you again in a word or two, because we'll have a couple of minutes for questions after this. What is the single greatest opportunity to end violence against children through cross-sectoral collaboration? If you can condense that down.
I think we need to be consistent. I think you don't need to reinvent the wheel, and you don't need a new program every couple of years. I think, for how many millions of years people have been on this earth, parents raise children, things happen, society. So I think we need to be consistent. We need to take something and follow it through. Honestly, you don't want the wind to blow every day and run to a new cause. It's old-fashioned. It's relatively simple. You provide good homes, good education, benefits, some of the fruits of living in New York City and in other places, and you just have to be consistent. You can't change the message every week.
I would say courage. I think we have to have the courage of our convictions, and really believe that we can make change even in the face of past evidence that change hasn't happened.
Thank you.
Yeah, and I think I would add to that resilience. I think I look at those young people, tomorrow, that march, and one of my friends in DC just hosted a panel with them recently, and I think I can only imagine what they must be going through to raise their voices so soon after that tragedy, and I think resilience and solidarity to stand with them. And I think we can speak about how things have gotten worse in the 21st century, or we can talk about how they've gotten better. And I think social media, digital platform, it's been a great leveler. And young people, what you're seeing, are more powerful than any previous generation before. And I just think it gives me great hope.
Wonderful. I'll turn to the audience. Yeah.
Hello. Good evening. At the outset, let me thank Dr. Diaz and Dr. Rubinstein for this wonderfully, phenomenally enlightening opportunity for each of us who have attended this conference. My first experience on the other side of the table with somebody who went through the trauma was ironically under Dr. Grimm. And I remember being distraught after hearing to the entire 7-hour session. And then she gave me a book, Too Scared to Cry by Dr. Ter. From that day, this was 9 years ago in this country, but from that day to now, this is the first time, Dr. Diaz, that I feel that at least we have the opportunities to access the help that we need when we see a child who has gone through this. But I know that I speak for most of the people here. How do we take this 2-day enlightening session to something like a consortium that each of us, not just the patients, not just the kids, like each time I know that all of us who treat or who have, who are in the provider phase of the session, we lose and we gain a lot of our own mind as we treat one of these children. So from this 2-day session, how do we make this into a consortium for something that each of us can access to and help heal and nurture our kids and us through this process?
I'm so glad that you asked that question, both because I'm sure our panelists might have a word or two on it, but because our co-chairs are on their way up next to answer that exact thing for you and to motivate us all to carry this forward from here. So I don't mean to disallow our panel from answering the question, but did want to let you know that we do intend on having some extended conversation to talk about just that in a moment. Anything?
So I would just say that all of us have to own it, okay? A physician, an advocacy group, the Mount Sinai Center here, we all have to own it. We all have to keep our eyes open. What do they say? If you see something, say something. And I think this has put an indelible blot in my head too. This is a wonderful experience to participate today, is now I know things I didn't know yesterday, and I can go home, I can spot something that I didn't spot last week or last month, and that'll help me in the future. And I think everyone who's here, who stayed to the bitter end, and I appreciate that, knows more than they knew yesterday. And so we're started something today, and I think that's great.
Wonderful.
And I would say, I'm not a clinician, but I think each of us, whether we're clinicians or teachers or social workers, you know, we each interact with individuals in the course of our daily work. And each of us has lessons that we've learned from that experience, if we think about them hard enough, that tell us not just about that person that we dealt with, that patient or that student or whatever, but something about the societal conditions that gave rise to the situation that we addressed with that person. And if we think about that and sort of abstract the lessons out of that and think about what is the appropriate policy or advocacy response to the situation we were dealing with in that interaction, and then take that into the circles that we all are part of, we can all be part of building that movement.
Fantastic, wonderful. Looks like we have one other question.
Well, as a co-chair, I shouldn't perhaps be doing it, but I still couldn't resist.
No, please.
The title Collective Action. When you see something, say something. We actually said before, do something. And I think it's really about our collective accountability. And when I think about the fact that most children who are being sexually abused are actually being seen, and we have seen the data, by the healthcare system, that all those kids, most of them go to school, and we haven't even seen that they were abused sometimes over a long period of time. Something is wrong. So I'm really happy to see how much we have community health workers reaching out, how we are working at the community level, but at the same time, we see that these kids are falling between the cracks. And we all complain about how many children now have different mental health problems. Knowing that many of these problems, the cause of those problems, is actually adversity in their early childhood and adolescence, and not looking at what's happening to these children through the healthcare system and educational system. I have this question: are we really doing everything we are saying we are doing, or maybe we are not monitoring the quality of our work?
Well, you know, I could take, none of us are always doing enough, right? Otherwise the problem would have been fixed. So, you know, times change, family structures change, the power of young people change, the influence of leaders in government and everywhere else change over time. You know, a doctor has a Hippocratic oath. A doctor knows what they want to see in their office every day, but I think we heard in one of the other panels, people don't always speak up. You need to develop a sixth sense to figure things out. Of course, every single community health worker in our company is fully conditioned. They have the number of ACS memorized, and we have long conversations, sometimes in the nights and on the weekends, about what to do. And so you always try as hard as you can. Every next class of medical students, we try and teach them a little more than I was taught. And so it's not a fight that's ever won. It's a battle that always has to continue. And we have to use all the resources. And we do see something, say something, but do something. I agree with that 100%. And I think one of the goals that we learned here is to maybe try and do more.
Any other final thoughts? I Could not agree more. I think the reflection of doing more and also learning more. I think every time any of us are involved in these types of conversations, that we do go away with so much greater understanding and an enhanced skill set about how we can influence these movements, influence change, connect with each other, and do better and differently and more. At the Clinton Health Matters initiative, where I particularly work at the foundation, we work on reducing rates of preventable chronic disease through a social determinants model. And so we know that community safety impacts an individual's overall health outcomes, that family and social supports, that substance use and abuse, all of these things influence the health continuum of that individual. And to have these experiences in childhood can manifest not just in what a child is experiencing now, but what a child experiences as he or she becomes a young adult and an adult, if we don't strengthen these protective factors that we've talked about and minimize and eliminate the traumas that they're experiencing. So I want to say thank you to each of you for hanging in with us.
Sorry.
Please.
I was going to add one extra point. I was just thinking it through because when you were just talking, Van, about transparency, and I think, Joanna, when you mentioned before about the fact that this still goes on, I was trying to think, you know, in Australia, we, like many countries in the world, we had a culture of systemic child abuse. And, you know, there were many institutions involved in that, one of which was, you know, and this is the data, it's evidence, so I'm not casting any aspersions, it's a matter of fact, one of them was the Catholic Church. And I just remember, you know, going back 5-6 years ago, there was a big debate because people knew this was underway, people knew that these things had happened, and, you know, there had been some like cases that had been prosecuted, you know, but people were like, well, you know, is this really the full situation, or is this person just taking the fall for everyone else? What's really going on here? And one of the most, I think, myths that was so pervasive, I mean, you know, it flooded MPs' doors, it flooded policymakers, was this idea that people that had been involved in that trauma didn't want their story heard. And, you know, yes, I think there's legitimate concerns about that, the idea that you don't want to be re-traumatized, but many people hadn't, I don't think, consulted the people who went through that trauma themselves. And actually, many of them wanted their story to be heard. Many of them said, I want to stand on the corner of the road and have the world hear this and have people held to account. And, you know, when you were talking about taking on the Catholic Church in Australia, you know, that is a huge institution. And on both sides of our political party, it's a huge thing to agree to do that. And it took real guts and it took leadership. And Julia Gillard, who was Australia's first female Prime Minister, eventually she just said, enough is enough. And she had heard enough from the investigative journalists, she had heard enough of these whisperings, she had heard enough, I think importantly, from the people themselves, and she launched what was a royal commission, which went neck and deep, and actually to the extent, I mean, it shook the very ramifications and institutions of power in Australia. Its ramifications are so deep that last year, the senior-most cardinal in Australia, Cardinal George Pell, who had actually, in 2014, left Sydney to take up the post in the Vatican, the third highest position in the Vatican. Last year, he was formally charged you know, with abuse allegations, brought back to Australia, and just last week his hearing commenced. He is the most powerful Catholic official in the world anywhere to be put on trial for crimes. And that was leadership, it was real guts that took that, but also it was a recognition that people themselves want their voices heard. And that's the kind of courage that we need right now.
Thank you, thank you. And yes, the other lesson has been when to step forward and when to step off. And that is now our cue, to step back and to allow others who have much to say to come to you and wrap up this tremendous 2 days with a plan for action.